Welcome back. The South African TB conference is currently underway with scientists revealing new developments in TB drugs and regimens, including methods to prevent people from contracting TB. They will also speak to the lag in critical interventions, particularly in the last 2 years, with the focus on COVID-19. To tell us more about the story, we now cross to our reporter Minoshni Pillay, who's on standby. Minoshni, thank you so much for your time. So now has there been a rise or a decline in TB cases since the dawn of COVID-19?
Khaleesi, good morning to you and the viewers. Unfortunately, we can say yes, and this is largely from what scientists are telling us, because fewer people are coming forward to be tested due to the restrictions that COVID-19 has posed in the last 2 years. So we are on day 2 of the SATB conference, and just to give you some of the stats coming forward so far, 25,000 people dying every year in South Africa from TB. TB being the leading cause of death, and not only in the country but in KwaZulu-Natal. And if we zoom out to a global perspective, South Africa ranked at number 8 by the World Health Organization as countries carrying the highest burden of TB. That list led by India, China and the Philippines, with South Africa reflecting at number 8. So here we are 2 years after the COVID-19 pandemic, and what will be some of the critical talking points? Quite critically, the co-infection rate between TB and HIV in South Africa alarmingly currently at over 60%. So that's key for delegates to speak about. How do we drop that rate this week? Key conversations. And secondly, diagnostics, to reduce the time from a patient being tested for TB to them receiving treatment can lead up to 5 days. A patient in this country may need to appear in person at the same clinic that they were tested at to physically receive their results in person. So how do we bridge this gap to get them tested and treated faster? With me now to tell us more, I've got a very critical voice from civil society, Sibongile Shabalala. She's the national chairperson. Sibongile, thank you for giving us your time today.
Thank you, and thank you for having me.
So Mbengile, let's just start right at the beginning now. What are some of the TAC's main objectives after this 2-year gap? How do we get back to controlling TB?
We need to do more. We need to work together with government. We need a multi-sectoral approach in fighting TB, and we need a political will in terms of fighting TB. As Treatment Action Campaign, I think you've seen us in 2021, we marched on the TB Day in Mpumalanga, calling for government to declare TB as a health emergency. Why we're doing that? Because TB has been killing thousands of people per year, and nothing has been done to prevent those deaths. But the COVID showed us that government, if they want to respond to issues, they can respond to issues. So we're calling for government to do what they did in TB, because TB has killed so many people in so many years. Out of that, what we got, it started to have conversation with the government, and we see this year, we saw this year where on the 24th of March, on the TB Day, the government declared they came with a TB recovery plan that we are working together on it as civil society and government. However, that plan is not costed. That plan doesn't have funding. And while I'm talking to you, the National Department of Health is sitting with the money from the Global Fund that has to implement that plan. So we are calling for the government to say they need to make sure that these funds go to people so that we can be able to fight TB, I mean to say, in all levels. But also the issue of preventative methods that are there in the country, which are very expensive for people to access them. And the government, it's only piloting it in 2 districts, which it's not even enough. TB is affecting everyone in the country, and we are living in poor conditions. People are unable to access services like they are supposed to do. We know that we've been talking about the broken healthcare systems, the unfriendliness of clinics. They not allow people to come back to facilities as they can.
Just focusing in then on those preventative measures, in particular the 3HP, tell us exactly what this is and why it is currently costed at such a high level.
3HP, it's a preventative pill. which a person, if there's somebody who's exposed to TB and is living with that person can be given 3 HP. So what does it mean? Then you cannot be able to have, or you won't be infected with TB because we are with a person with the TB. That pill, you only take it once a day, once a week, I mean to say, in 3 months. So it lessens the burden of taking pills every day, because we know that for now you are forced, when you have a person who has TB, to take pills every day, which people sometimes they are unable to take them until they are infected with TB, and also it causes a multi-drug resistance to them. So we are calling for 3 HP to be available, and in South Africa that drug, because we are a lower middle income country, it costs about $14. So that money it's too much, because when you convert it, it's about 200 and something. But for 3 months, then it takes you to 2,000 to 300, to 2,000, 3,000, which it depends on the inflation rate. So the country like South Africa, we cannot afford to give it to all people. So we as civil society, we are calling for treatment for all. We are calling for government to put more effort in terms of fighting TB. We are also saying they need to make a real-time data available, because the data we are talking about it now, with the data that we got it yesterday, but when you go and find data in resources, you can't find it anywhere, especially the data that talks to TB. So which makes it difficult for us to measure how far are we working on TB, how are we doing as a country. So we want all those things to be made available to civil society and to communities, so that we know how to fight TB.
Sibongile, if you could just very briefly and finally now tell us your lived experience. You are a TB survivor yourself. You were diagnosed in 2004. Just very briefly, has the healthcare system changed, either in a positive or in a negative way, in terms of someone being tested and being able to access treatment for TB?
For me, it has changed negatively. I know that we have to go with the times. I know that there is technology that we are using, and we've had here in the conference many of government officials and leaders are speaking about people now are traced using SMSs, are sent SMSs, but we know we have a problem of electricity in the country. What if they are sending the electricity, the SMS, and I don't have electricity, I can't charge my phone? What if they are sending the SMS to the phone that I've lost last week because of crime? So that SMS is no longer connecting. It doesn't create that bond and relationship between a patient and a healthcare worker, irrespective of if it's a community healthcare worker. When I was diagnosed with TB in 2004, there was not supporters. So when you were supposed to go every day to the facility to take your medication, but if you miss your date, then that supporter the next day is coming to your home to make sure what is happening with you. Are you having any side effects? Why were you unable to come to the facility? And they will support you until you are taking your pills like you are supposed to. So if you are like I was, when I was not there, I was admitted in hospital because I had severe side effects. I was unable to breathe. I have severe shortness of breath, and I had to be admitted. But the dot supporter advised my family to say, make sure that her pills are there so that she can continue taking her pills. She must not stop taking her treatment. So which that direct contact and support, it was better. Like now what is happening, now we don't have dot supporters, now we don't have support groups for people living with HIV and TB. Now we don't have adherence classes or adherence sessions for people taking a TB medication and ARVs, which that is what we need, not just to decant medication, but we have that relationship, because a person who has infected with TB, that person psychologically and physically is not well. So we need that personal contact and relationship between the two people, so that we can be able to encourage more people to survive on TB.
All right, that was Sibongile Shabalala, the national chairperson for the Treatment Action Campaign and a strong, outspoken TB survivor herself. No doubt one of the strongest civil society voices in Durban this week at the SATB conference. And Khulisi, it's back to you.
So Minoshni, let's talk about what is expected to come out of the conference today, because there's always been conversations. When there's conversations about COVID-19, there were also back-end conversations around whether or not we were ready to deal with that particular pandemic. So as far as TB is concerned as well, what are some of the conversations that are being had there around readiness to tackle TB as well?
Well, Mxolisi, TB is a disease that is 120 years old in this country, and it is entirely curable. So the question on many people's minds is, A, we need to get back to basics after the 2 year of, resources and research and scientists being directed at COVID-19 and in that fight. So getting back to basics, like Sibongile said to us earlier, the numbers we're being presented with are pre-COVID numbers. And the challenge that we've had in the last 2 years is that people are simply not presenting to be tested. So how do we have an accurate reflection of how many TB infected persons we have in this country? And obviously that will feed into global stats as well. But also, differences in between scientists and civil society. Scientists saying we need more investment in diagnostics. We have the gene expert test that now rapidly tests for TB, but calling for further investment and commitment, not just from government, but from private sector. But civil society voices like Sibongile is saying, a simple SMS is not going to work. You'll remember during COVID, a COVID PCR test, you or I could have done it and received our results as quickly as within 24 hours. That is not the case with TB, but civil society is saying the old-fashioned community workers on the ground is really what makes a difference in getting patients not only to test, but to adhere to regimens. So lots of, different voices. I think it's going to be a week to regroup on South Africa's TB story.
Minoshni, have to thank you so much for that update indeed.